The demands of firefighting require members of the fire service to maintain their operational readiness. Physical and mental health are of the utmost importance. The physical demands of active firefighting and associated tasks are often misunderstood and underestimated. Research about the challenges facing today's firefighter is being actively undertaken with comprehensive scientific studies. The researchers creating Usable Emergency Solution, also known as RESCUES project, is connecting the fire emergency service with researchers. RESCUES has identified critical areas of focus for health and wellness for fire emergency responders. Did you know, according to the research study, an examination of the benefits of health promotion programs for the National Fire Service, firefighters suffer from a high prevalence of obesity, substandard fitness, and cardiovascular-related deaths. This study looked at the health of firefighters from departments with both established health and wellness programs and those that have none. It found that firefighters with established department health and wellness programs were healthier than those that didn't have an established program. Among their many findings, both groups were found to have high prevalence of smokeless tobacco use and binge drinking.
I think the benefits of a fitness program are tremendous, and I believe that this is a core competency in any department, and that is to have a program where you can make sure that your people are ready to do the job. We never know when we're going to go to work and put your body under the most maximum stress that it's going to be at. So training and being ready and being in shape is really important. As a fire chief, you're talking about less injury time for people, a well-fit workforce that does have injuries, which is going to happen whether it's training or on the incident, can get back to work sooner as well, just like any of us. So there's a lot of benefits to a program like this.
Rick Vestal is a heart attack survivor who takes every opportunity to share his story.
I hope that other firefighters will take this seriously. I was 43 years old, felt good, did not only cardio aerobic, but weight training. I felt like I was in very good shape. My heart attack actually started at about 4:30 in the morning. We got up that morning to run a medical call. My stomach didn't feel well, felt like I was having a little heartburn. Never had any chest pain, shortness of breath, dizziness, shoulder pain, any of the typical signs. That morning also started our 4-day break. I went home, continued that day basically as I would any other at home. My wife got home about 5 o'clock in the afternoon. I was sitting in my recliner, which is pretty unusual for me. I usually stay pretty active. She walked in the door and said, "Wow, you look like crap." "Thanks, honey, good to see you too." There are times when you really should listen to your wife, and I'm glad I did. Went to the emergency room, discovered that I was indeed having a heart attack. It was left anterior descending, or LAD, also known as the Widowmaker. Holy cow, you know, how did I not see this? I'd been a nationally registered paramedic for 18, 20 years, and you know, I kind of missed the boat here. They proceeded to place 4 stents in the LAD. The cardiologist said, basically the rest of the vessels, the rest of the heart was unremarkable, looked in great shape. I was angry, coming to grips with what had happened, and my exact words to the cardiologist were, "So much for working out, taking care of yourself, eating right." And he said, "You don't understand. The only time we typically see this 100% blockage is on autopsy. So if you had not been in top shape, the likelihood of you actually surviving this would have been very slim indeed." Don't pass over or overlook signs and symptoms that may be significant. So at 43, I was quite surprised, but understand that it can happen.
All research must be evaluated based upon the needs of individual firefighters and the needs of departments. RESCUES is a project of the International Fire Service Research Center and Policy Institute, and is funded by the FY 2013 AFG Fire Prevention and Safety Grant Award. Visit firesearchpolicy.org for more information.